Patient prep. I'm just write prep because I don't want to write preparation all the way out. Welcome, y'all. Thank y'all for tapping in, tuning in to Persevere Allied Health Institute. I am your host and instructor, motivator, VEE, babe. And we are talking today so many things phlebotomy, but we are about to discuss patient preparation. What does that even mean? Why is that even important, right? So many reasons why patient preparation is super important. And here we will go over why it's important. So let's go. Patient preparation is essential to patient preparation is essential to set up and have and know and understand, because it literally will be the determining factor for the outcome of the experience for the patient. And you don't want the patient to have a negative experience, because one, they're going to tell everybody about it. Two, they probably won't come back. And three, then they're going to be putting in surveys and stuff like that, and they're going to be looking at you like, what was wrong with this tech? So part of patient preparation is, one, making sure you're together. What does making sure you're together mean? Making sure that you're together means that you look polished, you look clean, you look neat, you look like you know what the fuck you're doing. You know what I'm saying? You don't want to be coming in a work or coming to draw somebody's blood. You about to draw my blood and you look disheveled, your clothes are wrinkled, you smell horrible. You're going to be looking like, no, I don't want you to touch me. You know what I'm saying? So that's why, that's a part of patient preparation, okay? That's all a part of it. Making sure you're good first. When you make sure you're good, then you look good, you're going to feel good, you're going to perform well. All of that shit matters, okay? Now, the second step is collecting your items. I'm going to just say collecting materials. Collecting your materials. Now, you can't collect your materials until you know what you need to collect. That's where having your lab requisition comes into place. Knowing, or rather, let me backtrack that. Having the order from the practitioner, so whatever doctor or nurse practitioner, physician assistant, whichever person wrote that order, for them to, it says on there what they want you to draw. Whether it was that CBC, that PTT, that BMP, that da-da-da-da-da. You knowing what it is you need, so you'll know what tubes to collect and what you need to mark on your requisition. So you will always have the order from the doctor, your collection bag, your requisition, which is what you will mark on there, so when the sample gets to the lab technicians know what they need to be running it for, the blood force, okay, what lab they're doing. And then you will need whatever you're going to use to draw the blood. So your butterfly needle, basically everything in here. Your butterfly needle, your holder, your tube holder, or bag container, they call it tube, your blood bag container, your alcohol, your 2x2s, your tourniquet, your gloves, and a Band-Aid or tape. If you don't have a Band-Aid, you could use tape. You could tape the gauze down on the arm, okay? But making sure you have all of your collecting materials is important, because say if you're doing mobile phlebotomy service and you go up to the patient's house, you're inside their house, and then you forgot something that you know you need for collecting their blood. Now you have to stop what you're doing. You probably already had a needle in everything, and now you got to go back and get da-da-da-da because you forgot. That's why going through everything to make sure you, one, know what the order is of what the sample you're drawing. Two, collecting all of that tubing materials that you need before going to the patient. And then three, being courteous and compassionate. I'm gonna just say compassionate. And you'll learn about this through the module. They're going to speak to compassion, okay? Making sure you're together, making sure you know what you need, and then being compassionate, okay? And that will ultimately give them the experience that will be a more positive one, because it's going to be experienced one way or another. It's either going to be a negative experience or a positive experience. Okay, you want to make sure it's a positive experience because you're together. You've done your due diligence to make sure you've properly prepared the patient for whatever it is that you're going to do. Okay?
Okay.
So know what you're doing. And then obviously being compassionate. So what compassion entails is, hi, my name is Shanette. I'm your phlebotomist today, and I will be drawing your blood. The doctor has ordered a CBC and a CMP.
Okay.
Are you on any blood thinners? No, I'm not. Do you have any questions? No, I don't. And that's how you initiate, as part of making sure you're together and initiating the compassion. You're talking to the person, you're expressing who you are, what you're going to do, okay? And asking them if they have any questions instead of just coming in and just going to draw their blood. Nobody wants somebody to just come in and just get the manhandling them and shit. No, don't nobody like that. Right, exactly. That wouldn't be a good experience, okay? A positive experience. And not all patients will say something to you directly. They may turn around and won't say nothing to you, but then as soon as the nurse come in or as soon as the doctor come in, they be like, that whoever just came in to do my blood, they were really rough. They were really mean. They may have been a little intimidated to say something to you. You know what I'm saying? So you don't know. But at the end of the day, you want to lead with these main 3 things here as part of your patient preparation. And I can just about guarantee you, if you do, then every experience is going to be a positive one.
Okay.
You will sometimes get those patients who be like, no matter what you do, it just don't matter. But then that's something with them. As long as you know in your heart that you did these main 3 things, then you know you're good. Okay? You got to feel positive in your heart. So, part of your patient preparation, we're going to go ahead and get the materials together I'm going to tell you what the lab is going to be. We'll get the materials together, and then you'll start practicing on the arm. That's what you've been waiting on, huh? Oh, that's the easy part, girl. All right, y'all, I just came on here real quick, y'all, to show y'all what patient preparation entails, and that doing these, I'm going to turn the camera around. These 3 things here is what's important for patient preparation and your patient having the most positive experience possible when it comes to their blood being drawn. Let's face it, everybody gets a little nervous and scared every time their blood has to get drawn. I mean, it's kind of a normal thing, if you will. I don't care what your expertise is, what your profession is, what your whatever is. So you are really depending on that technician to, 1, be knowledgeable, to 2, be compassionate, and to 3, okay, to 3, make sure that they know what they're doing, right? So that's why patient preparation is so important and such an essential part of our curriculum here at Persevere Allied Health Institute, okay? And we definitely dive deep into that, what that entails. I could just show you how to draw blood and then that'd be it. But it's more to it than that, because you might be one day drawing my blood. And you gotta know, I'm gonna make sure that you know what the fuck you're doing before you draw my blood. So yeah, you never know. So that's why we instruct the way we do here. We make sure that all students, all technicians are properly educated and properly practicing to make sure that they're providing the compassion and care that's necessary to take care of our community, okay? We love y'all and appreciate y'all for tapping in and tuning in. Stay tuned as we will be coming with more lives, whether it's here on Instagram or on Facebook. And then whether we're actually doing the skill, so you get a chance to see that, or we're talking about some of those necessary components that are really essential when it comes to learning how to do any skill set. We got to have the knowledge too. Add that with the skill, boom, you have a positive experience, okay? I love y'all. I appreciate y'all. It's your girl, Motivated V-E-E, baby. And I'm coming to you live to show y'all what we doing here at Persevere Allied Health Institute for the Certified Phlebotomy Technician Program, okay? Hey, if you want to sign up for the next cohort, which is starting Tuesday, December 6th, you could do so right now. Just go to the website, perseverealliedhealth.com. Easily apply. Very soon as you get to the front page of the website, boom, click apply now, and boom, there you go. You'll be able to fill out the form, and you've applied. And then you get an opportunity to be in the December cohort and be making money in a minute. Y'all already know that the healthcare field is always hiring. It's always a need, a demand, okay? If you have any questions, email us at perseverealliedhealth@gmail.com. Ask us any questions. You can also text us. I believe the number is in the bio. If not, it is 313-473-0434. Sorry. Okay. All right, y'all. I love y'all. I appreciate y'all. It's your girl, Motivated VEE, baby. Out this week.